local, late breaking. You're watching KCAL 9 News.
A young man's life was turned upside down in a split second. It all began with a horrible car accident that literally left him without a face. Tonight, an exclusive first-hand look at how doctors not only saved his life, but also saved his face. Our Dilva Henry joins us now from Northridge Hospital Medical Center with tonight's prime assignment, saving face. Dilva?
Pat, this truly is an amazing medical case, not just because doctors saved his life, as you said, but because of how they saved Raul Valdez's face. And yes, our cameras were the only ones there during this 5-hour procedure. Now, it is very new technology that's allowing Raul to lead a perfectly normal life now. And that's something he never thought would be possible after this kind of accident. Now, certainly a word of warning here now to bring you this kind of medical breakthrough, and it is just that. Some of this video is graphic. It happened in a split second. Raul Valdez has trouble thinking about the accident that almost took his life, and trouble talking about it.
Friends, like, they tell me, sorry. I almost died, you know.
Less than 2 months ago, Raul was in an accident at work. A car smashed into the truck he was standing by, causing a ladder to literally slice off Raul's face.
I just turned around, somebody said, watch out, and that was it.
After being rushed to Northridge Hospital Medical Center, doctors had to work fast.
He's a real lucky guy. Lucky guy.
Not just to save Raul's face, but to save his life.
He actually had such severe injuries and such severe bleeding that our first goal was really to save his life.
Now that doctors had saved Raul's life, they knew saving his face would be even more difficult.
And this whole piece here is separated and pulled away.
But Dr. Marc Kerner, a renowned facial plastic surgeon, realized something, that Raul was the perfect candidate for a new procedure, a series of techniques that could make Raul look normal again, have a life without a face full of scars.
We're using different surgical approaches where we don't have to put any incisions on the face. We harvest the patient's own blood, and we take the platelets from the blood at the time of surgery, and we mix that with calcium and another drug called thrombin, and it basically becomes like a wound-healing gel.
But when Raul saw what he looked like before the procedure, all the bruises, the swelling, his face distorted, he wasn't so optimistic. At 30 years old, Raul thought he would live out his life with a face he would want to hide.
When I wake up, I saw a big nose like that and a face, and I thought I was never going to recuperate.
After 5 hours of surgery, he did recuperate. In fact, better and faster than even doctors had hoped for.
There's much less bruising, there's much less swelling after surgery, and the time to healing is just much reduced. Basically, at 5 days, he looked like somebody we would see after about 2 to 3 weeks.
We talked to Raul just 12 days after surgery. We couldn't believe it. We could hardly make out the scars and stitches. His doctors couldn't believe it either. They say he looks even better than before, and Raul humbly agrees.
And I look like maybe better than before.
But more important than getting his face back is getting his life back. Raul credits his expert team of doctors and what he considers his guardian angel.
I feel like a very lucky guy and a big angel they have.
Very, very fortunate. Now, although Raul looks just great, he says he is a little bit sore, but we are happy to say doctors expect him to make a full recovery. Now, also, the new technology you just saw, in particular the blood platelet gel, can be used, doctors say, in all different kinds of operations that typically require lots of stitches, and certainly physicians are very, very excited about that. That, too, great news. Reporting live from Northridge, Dilva Henry, KCAL 9 News.